Hey guys, in this video we're talking about the 7 traits or diagnostic criteria used to diagnose avoidant personality disorder. Please remember that this is a personality disorder. It needs to be diagnosed by a certified professional such as a psychiatrist. This is simply for information's purposes so that you are better informed and empowered to understand the thinking that goes on behind your or your loved one's diagnosis. Avoidant personality disorder is a particularly difficult diagnosis to make. It takes often multiple sessions over weeks to months to make the diagnosis because it can be misdiagnosed with other similar conditions such as social anxiety disorder, other anxiety disorders, or even depression. This is not a diagnostic video, it's just for information purposes. If you're new here, hello, my name's Sil. I'm a final year medical student. I've just finished medicine. I'm starting as a junior doctor in a couple of weeks as in a psychiatry team. I'm really interested in mental health and making mental health videos to educate and empower people so that they can make the best decisions for their healthcare. Consider subscribing. Okay, let's get into it. The 7 traits. Look, I thought we'll go straight to the actual criteria that's used by the DSM, which is the reference that a lot of psychiatrists use to make diagnosis of psychiatric conditions or personality disorders. And let's open that up now. Okay, so here we are in the DSM. We have avoidant personality disorder as a cluster C personality disorders. There's also cluster B and cluster A personality disorders, and there's also other cluster C personality disorders. There's a lot of personality disorders. Quick point about personality disorders. It is a controversial area in psychiatry. It is kind of better termed complex trauma because, saying that someone has a personality disorder can be seen as quite offensive. Personality is so personal. It's your identity. And to say it's disordered is quite a personal attack. That's not the goal of personality of why personality disorders exist. It's much more just about identifying traits and characteristics that are causing dysfunction in your life or in one's life. So in avoidant personality disorder, it's not about shaming someone to say they're shy, so they should feel bad about that. It's more just identifying that shyness and is a key part of why they're not having the life that they want to have. And then you can identify why they're shy and how to work on that. Now, I'm using the term shy pretty loosely here. It's much more than just being shy, and we'll go through the criteria now. So let's just read through the DSM. The DSM, of course, is an important text. It's often used as a reference for diagnosing conditions, and so that's why I thought I would use it as a reference, just so that you're getting it from the horse's mouth here. So, avoidant personality disorder, it's pervasive pattern of social inhibition, feelings of inadequacy, hypersensitivity to negative evaluation, beginning by early adulthood and presents in a variety of contexts, as in dictated by 4 or more of the following. Okay, that was a mouthful. Let's break this up a bit. First of all, it's pervasive. It's a personality disorder. It's been there your whole life, really. And you don't really diagnose personality disorders in people, definitely not under the age of 18 because personality is developing. But also, if you probably want to wait till mid to late 20s before this diagnosis is established concretely. And that's an important point because that means, it might take a long time before this diagnosis is fully locked in. So if anyone says on the first time meeting you, like a therapist says, that's avoidant personality disorder, maybe that should be a red flag that, this therapist might not be perfect. And so it's pervasive and it's really characterized by shyness to the nth level. It's social inhibition, a lack of being able to kind of be yourself, feelings of inadequacy, hypersensitivity to negative evaluation from others, and it's in a variety of contexts. So it's not just in relationships, it's also in your work and your choice of career, and in where you go shopping and when you go shopping. So it's multifactorial. It's in a variety of contexts. And it has to be 4 or more of these 7 traits. So the first is one might avoid occupational activities that involve a lot of interpersonal contact, which if you think about it is very difficult. A lot of jobs require interpersonal contact. And this might present itself as someone who has stayed in an entry-level role for a long time, doesn't want to be promoted because of the increased interpersonal requirements in their field or whatever. And it's really around the fears of being criticized and the disapproval and rejection. And they, really might not want to give presentations and that sort of thing. That can get a bit complicated with social anxiety disorder, but we won't go into that right now. The second criteria is the kind of hesitancy in getting involved with people unless they're certain of being liked. And that's very difficult because you can't control what people or how people will feel towards you in life. And so they might have not a large number of close, intimate relationships or none. And it's not because they don't want close, intimate relationships. It's because they or you might just be so scared of being negatively evaluated or, criticized or not loved by the person that you want to be close with. The next criteria is similar. It's showing restraint within intimate relationships, and that's around fear of being criticized or being shamed, and that'll present itself as one not really opening up, not being vulnerable, not talking about their kind of sexual fantasies or childhood or embarrassing moments in their life and that kind of thing. Okay, the next one, number 4, is they are preoccupied with being criticized or rejected in social situations. And this is often demonstrated in the fact that in a conversation, they might not share their opinion, even if they do have a strong opinion of something, because they're so scared of how people will think about them. They just won't get it off their chest and say what they actually think. It might also mean that they're not listening with full attention because they're so worried about what other people are thinking about them. So they might feel a bit distant. Okay, criteria 5 is they feel inhibited in new interpersonal situations because of feelings of inadequacy. So that can be a new friendship or a new colleague or a new whatever. And they might not want to share certain things of themselves. They might not want to say what they do for work because they might feel that they'll get judged. Criteria number 6 is they view themselves as socially inept, unappealing, and inferior. So, they'll often put themselves down. You might have quite a cool job or whatever, but you'll not want to share it. And if it does get shared, you'll put it down and you'll self-criticize. So the final criteria is that often people with avoidant personality disorder are reluctant to take personal risks or to engage in new activities because they may prove embarrassing. So, for example, diving into a pool. They might not want to dive into a pool because they might feel people would judge them for this kind of thing they don't do often, and so they'll walk in slowly or something. Or even going to the pool in general might be, quite a concerning situation for people with avoidant personality disorder, depending on the situation. But you can get the gist. I mean, I hope from all this you can see that the key themes are this fear of what other people think about you, presenting itself in multiple situations. It's not just one thing. It's work, it's activities, it's relationships with your friends, with your family, with your partners. So it's really multifactorial. It's holistic. It's really encompassing. And you only need 4 of those to get the diagnosis. But remember, you can't diagnose yourself based on this checklist. You have to see a mental health professional to do that. I'm just showing you this because if you feel like you have some of these things or someone you know has some of these things, that can trigger some red flags and empower you to talk to a mental health professional and describe what you're having or what you're experiencing. So that's it for this video. We've talked about the key criteria of avoidant personality disorder. If it's been helpful, please consider subscribing. I'm a small channel, but with your help we can grow and help empower the world and make the place more mentally healthy. You can also leave a like on the video. That really helps me personally, as it means my videos will be more recommended to other people. And leave a comment down below if there's anything you want me to make or if you have any feedback about the video. Have an absolutely lovely day, everyone. See you in the next one.